cool. So I got it. Okay, this is really cool. I am so excited to be able to present this to you because my raising as a therapist was in Gestalt for 30 years. So what's happened here is that CBT has recognized that relational therapies may, in terms of the client, a relationship between the client and their voice, in real time can be influenced using an empty chair technique for cognitive restructuring in a huge experiential way. So let's see if I can get this thing to go. So you remember this slide, or you may not, because you've seen it years ago. These are the effect sizes for CBTp. And you can see that they're pretty good. They're moderate, 0.47, 0.44. We're looking for upwards towards 1.0 or above when we see that effect size. We're working towards that direction anyway. So if we can see that CBTp offers a lot of good effects. General well-being, of course, 1.16, that's huge, right? So we can do even better with CBTp when we include other techniques from other orientations. So in CBT, we work intensely with gathering evidence to help the client understand or become aware that what they're experiencing is a hallucination, and to accept it, and to kind of either distract or focus themselves away from attending to those hallucinations. And that helps. It really does. A lot of people can, in fact, change their need to attend to those voices through CBTp. We do a great job of that. But it might not be enough. There's more that we can do. Some of the voices, as you know, working with your clients, even with therapy and even with great medication, still hear those voices. And a lot of those voices just never go away, even for those patients that fully recover in terms of being functional. So instead of trying to take them away, which is basically entering into a power play, or instead of trying to convince the client that they're not there or they can't hurt you, another way to do this is to have the client speak directly with the voice using an empty chair. The idea here is to improve the relationship with the voice because they're going to be there long term. Let's face it, let's not try to get rid of something that's going to be there. In fact, we can make that voice, or we can influence the voice via the client to be even effective in their life or beneficial in their life, which now there's a new thing, right? So the framework is interpersonal, and it can be done in a variety of different ways. And I'll really quickly show you the different techniques of empty chair work. So in relational models, we look for a better relationship with the voice. Let's see, I've already done that. Let's look at each of the models. Okay. So the first model is CBTp for command hallucinations. So the goal is to help the client change their own beliefs about the voices. So they, a lot of those beliefs are they must obey, they'll have consequences, etc., if they don't obey. So in this technique, the first chair is for the client to tell the empty chair, which is representing the voice or voices, how they feel about the voice being there, how they feel about the voice's insistence on being there all the time, intrusive. And then when the client changes the chair to the second chair, rather than taking the position of the voice the way we might do in Gestalt therapy, they're actually sitting in the second chair, encouraged share the skills that they've learned through therapy. You can see doing CBTp first to prep the person is really helpful. So the second chair then is for the client to say all of the assertive statements that might go with telling the voice, I'm not going to attend to you, I'm not going to obey you. And we kind of do that in therapy, right? So we have them perhaps develop a new belief and even say that out loud. Here we're putting them in a chair. We can also do this with the client taking the place of the command hallucination and describe how it feels from the voice point of view to receive that kind of feedback. And then the therapist becomes kind of a couples counselor, actually, is what we're talking about. We talked about this at Mahoning yesterday. I even walked Brian through that to do with a client. And so that's basically kind of couples counseling. How are we going to resolve the conflict between the voice and the person? I know that seems like bizarre and overwhelming, but I'll do a second presentation, I hope, at some point to actually show you what that would look like. Sadly, CBTp for command hallucinations and doing it this particular way doesn't work very well. There was no difference between this kind of empty chair work and treatment as usual. So let's go to making sense of voices, and it's an experience-focused counseling. This is designed to actually work with the trauma the person may have experienced and designed to help clients accept the voices and really cope with them in a different way. And so the idea is to determine the reason that these voices came about, take a look at the client's history, see where those trauma pieces are reflected in the voice, help the client understand where that content is coming from, and then find positive ways to improve the relationship. You'll probably remember me talking about a client that I had whose voices told him they would kill his parents if he used substances again. You know, that's a horrible way to say, we're encouraging you not to use because there'll be big consequences. So it's our job to kind of find the new words, right? And allow the client to hear that maybe there is a helpful or beneficial side to the voices, but we need to help them reframe what the voice says. In this theory, the voices are seen as dissociated parts of self, right? And so eventually we want to incorporate that other dissociated part within the client, but that's kind of way down the road. So the dialogue starts with the most distressing voice here, and the therapist's job is to resolve that conflict and have some kind of understanding on both sides, from the voice and the client, what's happening here. So we need to engage and educate the client about that. It's a really odd thing to do, and a lot of people are so uncomfortable with role play. The thing about role play is that it is experiential, and when we experience whatever that is as a client, the learning is very deep and anchored, and we're far less apt to forget it. We do the assessment and formulation just like we would do with CBT, and then we start the dialogical work where there's an empty chair that represents the voice, and the therapist asks questions to the voice, and the voice hearer is the intermediary. So the voice hearer kind of guides the conversation to help the therapist know how that would really go. And the hope is to arrive at those goals that we saw before, for the client to have better self-esteem, better control, less distress. Then at the end, we evaluate and consolidate whatever learning has occurred. Well, for this one, there was no significant differences when they looked at the audio hallucinations on the CIRAT scale. Although significant effects on the BAFQ scale, 0.78. That's pretty powerful. So the voices became less powerful, even though they didn't go away. When these were case studies done in this particular study, participants were invited to share what was helpful and what wasn't, or how the technique worked, I guess. There were 12 participants in all, and 6 of them felt less distressed and more able to be in control of the voices and to be able to go out and about and do things without those voices interrupting. The outcome for this kind of therapy, there was actually a random controlled trial for emotion-focused counseling, is what this is called, to treatment as usual or supportive counseling. So again, there were no effects for within or between group differences post-treatment, but there was a huge, significant reduction on the brief psychiatric rating scale, the subscale used for psychosis. And so if we've got people that are prodromal or having brief episodes, this is a great technique to use. There were definitely improvements, but they didn't reach, in terms of p-values, a significant place. Relating therapy. This is kind of the cool stuff. Goals is to reduce distress by modifying the relationship between the client and the voice, and the voice's acquaintances, and the client's acquaintances. So when the client perceives them as dangerous. There's 3 phases to this as well, or possibly 4 now that I'm thinking about it. First phase is consider the implications and consequences of talking to the voices, because a lot of people will go, I don't want to talk to those voices. I'm going to get some retribution from that. So we want to help them to understand that this is not about taking them away or punishing them or speaking badly to them. It's learning how to talk to them and receive communication back, kind of training people how to treat us the way we would do in any relationship. And what we want to do with that voice is to find out where they came from, what was the purpose of the voice. So again, my client with the voices that say, I'm gonna kill your parents, the intention was beneficial, even though the method was horrific, right? So we need to reframe that. The third phase of this is to do the actual therapy in terms of creating boundaries, establishing them and maintaining them with the voice. And so we practice with an empty chair representing a voice. And the client then, and the therapist and the voice have kind of a trialogue together. And they all talk together about how the client may respond to the voice. And when I do this activity with people, when I put them in the empty chair to take the place of the voice, I have them speak in first person. So I'm the voice and I would say, I am angry. I am worried that you're going to hurt yourself. I'm worried that you're being followed. If that makes sense, does that make sense? Right, and when they go into the other chair, they're their client and also speak from that first person. So a lot of it is assertiveness, teaching the difference between assertiveness, aggressiveness, passiveness, just as we always do, and to find some balance in how the voice and the client respond to each other. Let's look at the outcome of this. Even though the power of the voice was perceived to be a little bit more omnipotent with this style, 2 of the 5 participants showed a reduction in distress from the voices. 3 of the 5 reported better control, and all of those effects were maintained at 3 months out. So it's kind of a trade-off, and I'm not sure what that artifact is with the clients perceiving control higher, but I'm wondering if it's an artifact of the design. I don't know. A random controlled trial showed very large improvements for audio hallucinations on the CIRATs. Look at that effect size, 1.4, and on the distress, 1.3, and changes were maintained at 36 weeks, which is just marvelous. So this is the one where we're actually doing the trialogue, the client, the voice, and the therapist, and basically doing couples therapy to help all of that balance out for the client, giving the client ways to respond to voices in a real experienced way, and to feel what the voices might feel getting that feedback. And I can demonstrate that in follow-up echo things. And we can actually use Brian if he's willing to come on and be a part of that. Avatar or virtual reality assisted therapy is super cool. And it is where the client designs through software a face that looks like the voice, that distressing voice, the most distressing voice. There's different ways to do this. The client and the therapist sit together in the same room. The therapist really controls the avatar on software that shows up on a TV screen, and the client talks directly to the avatar voiced by the therapist sitting next to the client. It can also be done with virtual reality headsets, which for me would freak me out. So this would be a patient that we would need to prep really well. So it starts out with negative content and the therapist saying all the things that the voices initially say, and then working the client towards more assertive, appropriate communication and having the voice respond back. There were 2 small pilot studies with this, large reductions for both trials. You can see the effect size 0.85 and the p-value is 0.01, maintained at 3 months afterwards. There was a huge reduction on the distress subscale. The voices reduced by 80 to 90%. And by the time the 3-month follow-up came around, the Beck Depression Inventory showed a significant drop in depression, even though it didn't show that immediately after the treatment. A larger RCT with 150 treatment-resistant clients, there were significant reductions on the CIRATs, improvements on voice control, large improvements on the BAVQ, most notably for omnipotence. The 1-year randomly controlled trial with 74 clients basically showed the same thing. Larger effect sizes on total CIRATs, moderate frequency, as you can see, significant improvements in persecutory beliefs. And for overall, there was a moderate drop in symptomology. These techniques are amazing. Of course, avatar therapy can be kind of expensive because you need the software and all that good stuff. So in lieu of that, the client can actually make a paper mache mask. So you need your art therapist to join in here and design the mask as the voice might look to him. And the client plays the part of the voice. That showed excellent benefits as well. And when we add a CBTp prep before all of this starts to do the education and to do some of the stabilizing techniques that we use, and then do virtual reality therapy using a mask or software, we find huge effect sizes too. Doesn't matter that it's just a mask. So look at that effect size, 1.486, and the p-value at 0.0001. And it maintained at 3 months follow-up. And it was best to use CBTp before we actually do that. And here, the therapist is wearing a mask and sitting in the same room with the client, opposite or next to, because they're a little bit less threatening. So this is a lot of information, and you need to stop now. All of this information came from one article, and there are many authors that came up with each of those different techniques, which I didn't have space to credit. So please, Jamie's going to send you out the article. I'm going to redo this so that you have all the citations in all the right places. And what I'd like to do is to follow up with this to show how it's actually done. There we go.